There are three ways of testing allergies in children. One is a blood test, second is a skin prick test, and third is an oral food challenge. In the blood test, we take the blood from the child and we test for any number of antigens that we suspect can be causing problem. In a skin prick test, we take the antigen and we do the skin prick. We prick the skin with all these antigens and we read the results in 15 minutes. Both the tests have equal sensitivity and specificity. That means the reliability of both the tests is exactly the same. These tests are not 100%, and if the test is positive, that does not mean the child is allergic to it. They may be sensitized to it. On the other hand, if the test is negative, that again does not mean that the child can have the substance, because they can still be allergic to it. To confirm the diagnosis, we do what we call an oral food challenge, in which the child is given the substance to eat in a controlled setting in hospital with all the resuscitation equipments to hand. If the child is able to tolerate it, then obviously the child is not allergic to it. On the other hand, if the child develops a reaction, then the child is allergic to the substance. So that is the best test we can do for allergy. We don't know, to be honest, but there are certain families which have the tendency to develop allergies. They have got allergic conditions like cow's milk protein allergy, various nut allergies, eczema, asthma, allergic rhinitis, and these are called atopic families. So there is something in the genetics which make these children or even adults prone to be allergic to certain conditions. Most people are okay with nuts, but if you give nuts to these children, they react to it. So their body recognizes that, for example, nut as a foreign antigen, and they mount an allergic reaction to it. So we don't know what causes allergy, but we do know that it runs in families. Why have allergies become so common is controversial and not 100% sure why it's happened. But there are certain factors to blame, like the hygiene hypothesis. What that means is that we have become very hygienic. We try to clean everything and keep everything 100% bacteria free. That is apparently not a good thing, because our body has forgotten how to fight against various antigens and bacteria. And the body is now recognizing these as antigens, like normal things which were absolutely fine. The body thinks that these are foreign bodies and they try to mount a reaction to it. And that, we think, might have led to the increase in the allergies in this day and age. Also, we used to eat everything without any problem nowadays. And there was actually a guidance which advised mothers, expected mothers to not to eat nuts and various allergenic food. That was not a good advice, because that has led to an increase in allergies. So now the recent advice is to eat everything as much as you can if you are already not known to be allergic to that particular substance. So allergy symptoms are different in different age groups. For example, in a baby who's only given milk, the development of a dry skin or eczema, if the baby starts to vomit after every feed, is very irritable. If he is constipated or has runny stools or sometimes passes blood in the stool, these can be symptoms of milk allergy. For food, it's very obvious. If you eat that particular food, for example, a peanut, and you start developing redness around the face, itchy throat, you may start to have a vomit or sometimes having difficulty in breathing. That's again a very clear symptom of allergy. There can be some situations in which the allergy is a bit more difficult to diagnose, where you may have gastrointestinal symptoms like chronic diarrhea, or you may have a very dry skin, in which case you may be allergic to something which will have to be tested to confirm. There may be, you may have hay fever and may be allergic to pollen. That again has to be tested, and that's the way to confirm that you are allergic to pollen, which might be causing your hay fever. Depends on what food allergy you have. If you have allergy to milk, again that can be two types. One is called IgE mediated, the other is non-IgE mediated. Non-IgE mediated you grow out of by the time you are 1 to 2 years of age. If it's IgE mediated milk allergy, then it can take a while. It can take up to 10 years before you grow out of it. Egg allergy, again you grow out between 7 to 8 years of age. Nut allergy is a difficult one. The chances of growing out of nut allergy are not that common. So if you have a peanut allergy, which is actually a legume, then the chances of growing out of that is 1 in 10, that is around 10%. While if you have a tree nut allergy like hazelnut, cashew nut or Brazil nut, then the chances of growing out is only 1 in 20. So that's even less than peanut. So nut allergies are really very difficult to grow out of. There is something called immunotherapy, which is recently being tested. It's not available via NHS at the moment. But immunotherapy is the thing where we give the substance you're allergic to in small quantities, and we expect you to develop a tolerance. But that's again in experimental phases at the moment. The treatment is mainly symptomatic. So if you have eczema, then we use emollient and steroids, and obviously the main treatment is avoidance of the allergen. So if you are allergic to milk, then we have to try a different type of milk which does not have the cow's milk protein. If you are allergic to nut, then you avoid those nuts. If you are allergic to house dust mite, then you keep the house as house dust mite free as possible. The treatment, again, in terms of medication, is by depending on the symptoms. So if you have asthma, then it's treated with inhalers, like you must have heard of the relievers and preventers, which are usually steroids, and the relievers are some bronchodilators which help to dilate the lungs. The mainstay of treatment is antihistaminics, because histamine causes a lot of problems related to allergy. So we take antihistaminics like Piriton, which is chlorphenamine, or cetirizine, or fexofenadine. If you have real difficulty in breathing, which is called anaphylaxis, in which you can collapse, the treatment is by adrenaline, which has to be given intramuscularly. And children with nut allergy who have had breathing problems usually carry what we call an adrenaline autoinjector like EpiPen, which is life-saving.